Hi guys, so today we'll learn something about the cranial nerve, and today we'll learn something about fifth cranial nerve. So as we all know, fifth cranial nerve is basically the trigeminal nerve. So before learning the trigeminal, we'll uh, tell how to describe a nerve. तो आपका जो nerve है, either it will come in a 5 marker question or it can come in a 15 marker question. So how to write it in exam, in a theory exam, is most important. So first we have to define that nerve. Be it any nerve, cranial nerves are 12, total 12 pair of cranial nerves are there. So for example, if trigeminal nerve comes, if glossopharyngeal comes, if facial nerve comes, so how to describe it? Firstly, we will define that nerve. So today we'll learn about the trigeminal nerve. So for example, telling about the trigeminal nerve, how to define it. So trigeminal nerve is the fifth cranial nerve. It is the largest of all cranial nerves, which has three branches: first, second, and third. First is your ophthalmic, second is maxillary, and third is mandibular. So we have defined it. Then about the course of that nerve, from which foramen does it come out, ठीक है, और कौन से canal से वो जाती है, into which canal does it go, which fossa, all that course we have to describe, and the nucleus to which it belongs, the nucleus जो उसमें involved होते हैं. Then comes to branches, जितनी भी आपकी branches हैं, and उस individual branch को you have to explain. Then obviously branches, when you'll describe the branches and the course, draw its diagram and write the clinical anatomy. So clinical anatomy can be, for example, in the case of trigeminal, you can explain about the trigeminal neuralgias. So moving on to the topic of the trigeminal nerve. So what is it? We have to define that nerve. So it is the fifth cranial nerve, and it is the largest of all cranial nerves, which has three branches. Now what are the three branches? V1, 2, and 3. First, second, and third. First is the ophthalmic branch. Second is the maxillary branch, and third is the mandibular branch. First branch and the second branch are always sensory, and last branch, which is the mandibular branch, is sensory as well as motor. So what does this sensory and motor means? Basically, these sensory means that they carry the sensory fibers. These sensory fibers carry the sensations. What type of sensations there can be? It can be either touch, proprioception, temperature, etc. So they carry the sensations. uh, Now talking about the motor, so motor fibers, it's basically not it does not carry the sensations. Motor basically means that motor fibers supply the muscles of the mastication, all the four muscles of the mastication, as well as the tensor villi palatini and the tensor tympani. So now we have to define the course of the trigeminal nerve. From where does it arise? We have to define the course. So this is a small diagram of brainstem. So as we all know, there are three main parts of a brainstem. Uppermost part is the midbrain. As you can all see, it is the midbrain. Middlemost part is pons, and the lowermost part is medulla. So here are these three parts. Now, obviously, trigeminal nerve will enter into before entering into the trigeminal ganglion, it will involve certain nucleus. So, in the brainstem, how does it move? The basic course is that trigeminal involves three nucleus. Main nucleus is at the level of pons. Main nucleus is always at the level of pons. So because it is main, so it is this nucleus is known as principal sensory nucleus. Remember that P for pons and P for principal. You can also remember it as that main nucleus which is involved in the trigeminal nerve is at the level of pons. So it is the main. So principal is the main head. Then the other two nucleus which are involved in the trigeminal nerve, one is at level of midbrain. So M for midbrain, M for mesencephalic. Then last is at the level of medulla, which is the spinal nucleus. So trigeminal nerve will come. It will involve. Uh, it exists. Its pathway from at the level of the pons. It will involve principal sensory nucleus also, some part of midbrain involving the mesencephalic, and some part of medulla involving spinal nucleus. Then it will come out from the trigeminal ganglion and give its branches. So after passing from these three nucleus, majorly at the level of pons, it passes from the trigeminal ganglion. This is the trigeminal ganglion, and there further it gives first, second, and third branches. First is the ophthalmic branch, second is the maxillary branch, and third is the mandibular branch. So these are the three branches. Now I explained that first and second branches are sensory. That means it basically carry the sensations like touch, temperature, proprioception. These sensory fibers are connected to the trigeminal ganglion. So it is these sensory fibers involves all these three branches, the trigeminal ganglion. It comes out of these this trigeminal ganglion, the sensory fibers. But जौन से हमारे mandibular के mandibular branch है, which is the last branch, it is also motor, and these motor fibers are not connected to this trigeminal ganglion. These sensory fibers are connected with the trigeminal ganglion, but the mandibular nerve, which also contains the motor fibers, does not involve this trigeminal ganglion. So where does these motor fibers come from? What happens is when the mandibular branch, last branch, which is the third branch, exits from the foramen ovale, motor fibers connect with this mandibular nerve and comes out. Not from this trigeminal ganglion, not from this. It is not related with this branch. Neither it is related with the second branch. It is only and only connected with the mandibular branch when it comes out of the foramen ovale. Okay. Basically, जब आपके सेंसरी फाइबर्स आते हैं, सेंसरी फाइबर्स जब आपके यहाँ से और थर्ड ब्रांच से एग्जिट करते हैं, तो जब सेंसरी फाइबर्स हमारी थर्ड ब्रांच से बाहर आते हैं, that is the only time when motor fibers intervene with those sensory fibers and come out of the foramen ovale. So coming on to the first branch, which is the ophthalmic branch. Now, obviously, we have to explain the course of the ophthalmic branch. So, obviously, बात है ophthalmic है, तो we know eyes से related है. It is related with the orbit. It is related with the upper eyelid. It is related with those parts. So, ophthalmic, O for ophthalmic, remember O for orbit. So, this ophthalmic branch has to finally go into the orbit. And the pathway of it is that first it will pass the orbital fissure, ophthalmic will pass the orbital fissure and move into the orbit where it gives off its branches. So what are the branches? So remember, ophthalmic branch comes, it enters into the orbital fissure, then it enters into the orbit where it gives its branches. So this is the first. What is this? It is the ophthalmic branch, which enters into the orbits, giving its three main branches. Now, what are the branches? First is the frontal branch. As the name suggests, frontal. So, name only gives its whole meaning and definition. Frontal. Frontal is the skull portion. As you all know, frontal is the skull portion. So, it will obviously supply the base of the skull, the forehead, the scalp, okay, and the upper eyelids. The second branch is the lacrimal branch. As the name suggests, lacrimal, that means tears. So it will supply the lacrimal gland. So where is the lacrimal gland? So lacrimal gland is basically at the lateral surface of the upper eyelids. So it will supply the lateral surface of upper eyelids. Then third branch is the nasociliary branch. So as the name suggests, naso, that means nose. So it will majorly supply the side of the nose. Now frontal further gets divided into two more branches. First is the supraorbital. Obviously supraorbital means orbit wali side. And second is the supratrochlear. Lacrimal has no further branches. Nasociliary has further three branches. First is the long nasociliary, and second and third are basically the ethmoidal branches. This and this one are the ethmoidal branches. So ethmoidal has anterior as well as posterior ethmoidal. So these were the branches, further division of the ophthalmic branch. So basically, ophthalmic has to pass from the orbital fissure to reach the orbit, where it gives off its further branches, and it basically supplies the scalp, the forehead, upper eyelid, the sides of nose, the lateral sides of the upper eyelid. Moving on to the second branch, which is the maxillary branch. Now, what is its course of the maxillary branch? So, a mnemonic for you to remember is RIP. Now, what is this RIP concept? So, as you all know, as I said in ophthalmic, that it has to go into the ophthalmic branch, has to go into the orbit via passing through the orbital fissure. So now maxillary nerve also has its course. It also has to pass from foramen or fissure or fossa to give off its branches. Now RIP, it's just a mnemonic for you to enter, for you to basically learn or grasp the concept. uh, it's not a thing to write in exam like RIP. Don't like it, write it as RIP in your exam. It's write the course of it, which I'll tell now. Like R stands for foramen rotundum. So first it passes from the rotundum, foramen rotundum. Then I stands for infraorbital fissure. From foramen rotundum, maxillary nerve passes to orbital fissure. Then P stands for pterygopalatine fossa. So it's an F, F, and F. That means foramen, fissure, and fossa. After passing from this foramen, fissure, and fossa, maxillary nerve gets divided into its branches. Now, what are the branches? It passes from the foramen rotundum, first of all, then it moves into the moves into the fossa. Fossa ke baad it moves into the infraorbital fissure. Fissure first and then fossa. So after passing through the fissure, always the nerve enters into a canal. A canal is basically a cylindrical structure through which the nerve passes. So in infraorbital uh, canal, it gives off its two branches, which is the ASA and MSA. ASA is anterior superior alveolar and the middle superior alveolar. Anterior superior and middle superior. Now, ये किस किस को सप्लाई करता है? Anterior, from the word suggests anterior portion. अब maxilla है, so remember the maxillary teeth. So anterior teeth कहाँ से कहाँ तक? It's anterior. That means the two central incisors, maxillary central incisors, the lateral incisors. So it supplies the anterior teeth, which is the laterals and the centrals. And middle superior means middle teeth obviously are premolars. So middle superior alveolar supplies the premolar teeth. Then moving on to the pterygopalatine fossa, here it gives off its three branches. Main is the PSA. See, here it was ASA, MSA and PSA. ASA was anterior, which supplies the central and the lateral incisors. Middle superior is the one which supplies the premolars. And PSA is the posterior superior alveolar. Posteriors, obviously, maxillary molars. Supplies the maxillary molars. Then gives off its some of its ganglionic branches and some of the zygomatic branches, which supplies obviously the zygoma, the zygomatic bone. So these were all the, in a very gist we can say, in a summarized form, the branches that you can learn for your exam. Then moving on to the last branch, which is the mandibular nerve. Yes, and in exam for 15 marker question, there can be a question on mandibular nerve also. There can be a question on maxillary nerve also, alag se. So for that, you have to obviously explain the whole maxillary and mandibular nerve with their course, with their foramens, nucleus and all. With the whole course, the clinical anatomy related with the trigeminal neuralgias also and related with that particular nerve also. Here I'm not explaining the whole, here I'm just explaining the mandibular and maxillary nerves and the branches in a gist and summarized form, because trigeminal nerve also comes in 15 marks. So for a detailed, more detailed version of mandibular and maxillary nerve, I'll make a separate video. So moving on to the mandibular nerve. So course, as I said, maxillary nerve passes through foramen rotundum. This mandibular nerve passes through foramen ovale. After passing through the foramen ovale, it moves into the infratemporal fossa. Okay, it's the infratemporal fossa. So I told you F and F. So in maxillary, it was foramen rotundum. Here it is foramen ovale. And then the fossa which was involved in maxillary was pterygopalatine fossa. And here is in mandibular, it is infratemporal fossa. So now you can relate those two. So now what are the branches of mandibular nerve? So here, there are three divisions of mandibular nerve. First is from the trunk itself. Trunk is basically the main mandibular nerve. The main mandibular nerve gets divided into two nerves. Okay, two branches. So that is from the main trunk. Then comes the anterior division. One goes into anteriorly and one goes posteriorly. So one gets divided from the main trunk. So from the trunk, then it's the one goes anteriorly, so anterior division, and another division goes posteriorly, so posterior division. So first is the trunk, anterior division, and posterior. So from the trunk, the mandibular nerve gets divided into two branches, meningeal branch and nerve to medial pterygoid. Then coming on to anterior division, where the nerve majorly gets divided into a branch called buccal nerve. Buccal nerve obviously supplies the cheeks. Then posteriorly, it gets divided mainly into lingual, inferior alveolar nerve, and the auriculotemporal. So, auriculotemporal, you can you can get from this name auricle. Auricle is your ear part, posterior anterior part of the ear. Okay, inferior alveolar and lingual. Lingual basically supplies your tongue majorly. Inferior alveolar supplies all the mandibular teeth, starting from anteriors, starting from central incisors till your molars. It supplies all the teeth. So this was a summarized form of the trigeminal nerve, which I could explain. If there are any doubts, please leave them in the comment box or comment section. And if you like my video, do subscribe my channel, like the video, do tell your thoughts, the uh, the things you need me to explain in my videos. Thank you. Thanks for watching.